Welcome everybody to our seminar tonight. My name is Steve Sarowitz and I'm here to introduce my friend Kevin Sabet. And Kevin is a remarkable expert on the cannabis industry, attended a little university called Oxford, advised a few presidents, Bush, Clinton, and Obama on this subject, wrote a wonderful book called Smokescreen. And I could go on all night, but Kevin, without me going on all night, why don't you tell us a little bit about your book and what you came here to talk about?
I really love talking about the subject because I think it's one of the most misunderstood subjects right now going on in the United States, especially with regards to drug policy. You know, today we passed a very grim statistic, officially over 100,000 deaths due to drug overdoses in the United States. So that number is, by the way, far higher. That's an undercount because we just don't have good ways to count that number. And it's also lags behind a few years. So we're probably talking about 50 to 75% more deaths even than the official toll from CDC today. A remarkable number, one that that many of us did not think we would see 10 years ago. Of course, much of that driven by the end state of people who are addicted, often fentanyl, as well as other drugs like cocaine and methamphetamine, which have seen a resurgence in the last few years. All of those drugs, whether it's cocaine, heroin, methamphetamine, fentanyl, the prescription drug crisis, which we are still having in our country, they all have one common denominator. And that one common denominator is that those people who are struggling with substance use disorder, which is what we call it, or addiction, the vast majority of those people started using drugs when they were young, when their brains were not yet fully developed. And the vast majority of those drugs tended to be what we call the big three. Tobacco, although that has really gone much less in vogue. So it's almost becoming the big two now, not the big three, but it used to be the big three: tobacco, alcohol, and marijuana. And yet we don't talk a lot about those drugs, especially alcohol and marijuana, and the effect of young people. Because the current crisis is not driven by young people being overprescribed Vicodin, although that definitely happens. That is not what's driving these numbers where they are. They're being driven because people have had a long career, you could say, of using and have not gotten the help that they need. And so I think the elephant in the room often in these discussions is the role of marijuana, because it's one that's very confusing. It's one where we have a for-profit industry that's giving us many mixed messages. It's one that many of our politicians want to run away from because it's much easier to talk about heroin than it is to talk about marijuana. Not many people are protesting for their right to use heroin, or they won't send you hate mail if you're anti-heroin, but they will do so if you're anti-marijuana, or at least if you're questioning where we are with marijuana. And really, that's why I wrote this book, Smokescreen: What the Marijuana Industry Doesn't Want You to Know, which I will talk a little bit more about. I became really interested in this issue over 25 years ago as a young person, where, actually middle upper class community in Southern California. And I really saw that drugs was an issue people wanted to sweep under the rug, but it was indeed something that I think we really needed to talk about. So that's why I am very happy to talk about it today. Just very quickly, SAM is a nonprofit organization, 501c3, that I co-founded with former Congressman Patrick Kennedy back in 2013, early 2013. We have a scientific advisory board. We interact with the press and the public. We're really there to educate people on the science of marijuana. We don't think we should go reefer madness on one end, but we also are very alarmed by really the casualness by which society is taking marijuana right now, given especially the harms we're seeing. And I'll talk a little bit about that. We collaborate with all the major medical associations around the country, and we're very proud to do that because we think this has to be based on science. We are not trying to overstate the case, but we're trying to translate the science into language people can understand. And I think sometimes people, when we talk about policy, which is not the entire subject of my talk tonight, but I do want to put this out there in the very beginning because I know it's on people's minds. There are separate issues, and there are many separate issues, but to simplify them, there are three here that often get conflated. The first issue being decriminalization or removing penalties for low-level users. I personally don't think low-level users should be, we should have criminal justice resources wasted on those people. I think they need to get help. I don't think they should be going to prison. And I also understand that there may be a medical use of certain compounds of marijuana, especially the FDA-approved medications based on marijuana, which have gone through rigorous scientific processes. The same standard we would expect on all medicines. I'm not a big fan of voting on medicine or, medicine by popular vote or by, sort of acclamation. Medicine shouldn't be a popularity contest, but I do understand that there are medicinal applications we should recognize. But that's very, very different than what we're talking about, which is the use, sales, production, distribution being legalized and really being commercialized. Because in our country, when you legalize something, especially something that can make people a lot of money, you commercialize it. And that's really what I am concerned with. And I think the first thing people need to understand, when I researched my book, Smokescreen, I was trying to understand better, is that we're not talking about the old joints of yesteryear, the old marijuana from Woodstock or even from the 80s. You don't even have to go to Woodstock, 80s and 90s. Which is often smoked. We're talking about an entirely new product, very highly potent products that have never before been on the market, that are being publicized, commercialized with zero regulation. Please don't buy the argument that states are able to regulate this. The states have no idea what they're finding. Actually, my book is really an investigative report in the current state of marijuana, and I interviewed multiple people who regulate marijuana in states. And they admitted that they really don't know what's going on, that things go under the radar. The industry is very powerful. You have the candies, the cookies, the gummies, all of these things, the cotton candy. And these are obviously getting into the wrong hands. These are not getting into the hands of adults who are, taking one gummy a month and calling it a day on a Friday night. This is really about mass use among young people. And really, we have a new kind of consumer of marijuana. 20 years ago, the average marijuana user basically consumed the equivalent of a bottle of Coke, like a 20-ounce bottle of Coke worth of caffeine. If you would look at the comparison now, it's like that 20-ounce of Coke drinker has now become someone who drinks 33 Starbucks cappuccinos every day worth of caffeine. That's the difference in terms of the average marijuana user today. We are talking about a completely different experience. And it's really something I talk about, which I call the addiction for profit model, which is a model we have for alcohol, which is the model Big Tobacco employed for about 100 years, and which is a model that Big Pharma employed to get us hooked on OxyContin, et cetera. And what does that mean? It means that they don't need everybody to use their product regularly. They only need about 20 to 30% to use their product regularly of all users. And they will make plenty of money by keeping those people addicted, by keeping those people coming back. That's how they make money. And we have to learn from our historical lessons. We've been through this. We've seen how this movie goes, whether it was Dr. Batty's asthma cigarettes, which were around in the late 1800s, or whether it was in the 1950s and 60s, where we had advertisements by celebrities. This is a playbook that Big Marijuana, it's a very successful playbook. I mean, Big Tobacco, just so you know, Big Tobacco as an industry is bigger than Coke, Microsoft, and McDonald's combined. So we are talking major, major money. And unfortunately, we're seeing the marijuana industry copy that. And we've just had an exponential increase in the percent of people using marijuana who use it almost every day. It would, marijuana and alcohol used to follow a very similar trajectory. Between 10 and 20% of past month users used it every day. Now we're talking for marijuana, it's way upwards of 45%. This is an older statistic. We're trying to get new stats, but basically close to 50% of past month users are actually using it every day. That's a number we have never seen before. That translates to about 15 million at least Americans using marijuana every single day. It's a huge jump from what we're used to. And they're using very highly potent marijuana. So that's why I'm worried about it. And I'm especially worried about it when it comes to our young people. You have to understand that the marijuana is a very complex plant, but there are hundreds of ingredients in it, by the way, much more complex than opium or coca. We know about some of those. We don't even know about what most of them do. But one of them that we know about is called THC, an active ingredient in marijuana. THC binds to receptors all over the brain and the rest of the body. And they bind to very important receptors that regulate a host of activity and really affect our activity. And your brain is developing about until age 25 or 30. So up until that time, your brain is still kind of figuring out who it is. It's pruning and cutting and shaping itself. Really, it's shaping itself from your experiences, from your DNA, all kinds of reasons why it would be shaping itself at that time. And we know that when you use THC, it binds to all of these receptors in the brain, really important ones: movement, memory, cognition, your motivational system, reward, and memory, immune system, reproduction, movement, pain regulation, and coordination, etc. And it's the reward and memory, the center part of the brain, that's responsible for addiction, because addiction is really, you really enjoyed something, you remembered you enjoyed it, and you wanted to keep doing it again. I mean, that's really what we're talking about. And so marijuana, there are tons of these receptors in that part of the brain. That's what makes it extremely vulnerable for young people, where those receptors and that brain activity is really just developing. And that's why we're now seeing much higher rates. And this really surprises people. This data came out this year. It's even surprised me, and I've seen a lot of data. This was in the Journal of the American Medical Association, top researchers in the country, finding that the prevalence of people who had a use disorder or an addiction among teenagers since when they initiated, so 12 months, 12 to 24, 24 to 36, 36 or more, marijuana was much higher prevalence than alcohol or cigarettes. That really surprised the researchers. They were definitely expecting cigarettes to be higher because tobacco is so addictive and nicotine is so addictive. But they didn't. They saw today's marijuana was actually hooking more kids. Pretty interesting. And finding that 25% of past year 12 to 17 users actually met the criteria for addiction. And this increased 25%, I should say, in those states that had quote unquote recreational marijuana, as they call it. So we're seeing that these policies have major impacts. And a lot of people say, well, marijuana is not addictive, or, I've never heard of someone who's addicted to marijuana. And that is definitely a myth that's out there, but it couldn't be further from the truth. Science has well established not everybody will get addicted, just like not everybody who will go over the speed limit will have a car crash. But when you do use, and when you use more prevalent, in a very higher rate, you are more likely to become addicted. Just like if you speed a lot, you are more likely to get into a car crash. That's why we have speed limits. Even though we know people will go over the speed limit, some will do just fine, but many others will not do just fine. So we are seeing the dawn of a new industry in this country that is coming from big tobacco. I'm not going to dwell on it here. I'll make sure the slides are available to whoever wants it. But we are really seeing big tobacco invading the marijuana space, huge companies that are coming into the space. We actually profiled almost all of them on our website. If you'd like to see it, you could learn about sam.org is our website, /industry profiles. And you could just open any newspaper or alternative newspaper, weekly, kind of standard sort of tabloid in these states, and you see the advertising, you see the coupons, you see the billboards. This is all over Southern California. It's making it equivalent to happiness, making it equivalent to having fun, to young people, to recreation. They're even copying some of the old mascots. I mean, unless you're over 30, you don't even know who Joe Camel is, but you've been exposed to him, but this time for marijuana, not tobacco. So they're literally taking these pages out of the playbook. They're going to all the, they're all over social media. They're all over these comic festivals and other festivals that young people go to. It's a deliberate attempt to hook our youth. One of the issues that was really important to me that I really wanted to tackle in the book was about social justice, because we hear a lot about how this is a social justice issue. So I interviewed many people. One of them was James and Charmaine Hayes out of Compton. And they told me that they're actually fighting pot shops in their community, even though it's legal in California. But they have stopped marijuana stores because they do not think young people will get ahead in life, who already are behind the 8 ball because of opportunities and resources not being afforded to them. They don't think that marijuana will do anything to help their cause. And obviously, I think they're right. And they also told me that more people are being arrested in their community for legal drugs like alcohol than even illegal ones. So if this idea that we're not going to have the criminal justice system around anymore really isn't the case. We actually still see arrest rates disproportionately based against people of color, especially among young people, even in legal states. Sometimes it's even going up. And by the way, you know, Black-owned businesses, minority-owned businesses are not happening in the marijuana space. It's a false myth. You know, it is a myth. So false by definition. It is a false hope, I should say, that we will be able to help communities with money from marijuana. It's not happening, folks. It's all big business. It's guys that look like me. But we do see that minority populations, whether it's California or Colorado or now Illinois, are disproportionately exposed to both licensed and unlicensed marijuana stores that are allowed to proliferate. Again, not surprising if we look at alcohol or tobacco or any of the other things in our community where it's very easy to get a lottery ticket, to gamble, a cigarette, alcohol, and now a joint, and now high potency marijuana, but it's difficult to get a good education or a piece of broccoli. That's the unfortunate part of where this goes. And, you know, the other argument we hear a lot about is if we, you know, open up marijuana, we'll get rid of the underground market. And in my book, I did an in-depth investigation on that and actually found that the drug dealers love marijuana being legalized. The underground market is growing. Why? Because they can undercut the legal price. They don't have to pay taxes. They are able to ride the wave of normalization while still selling and making a profit. We're seeing this happen all over. You know, this is one area that where health officials in both, whether it's, you know, two very opposite presidential administrations, Trump and Biden, they actually both agree on this. The surgeons general, the people in charge of health, Jerome Adams, who was one of the most respected people, I think, in Washington over the last couple of years, talking about how this is a dangerous drug. This isn't your mother's marijuana. It is more potent. And the current Surgeon General, Vivek Murthy, who was also, by the way, the Surgeon General under President Obama, basically saying that public policy is outpacing the science. We know marijuana is addictive, and you know, we don't even have the high quality evidence we need to call it a medicine in many cases. So, I mean, this is what scientists are saying, and we really can choose to listen to the scientists or to the for-profit, you know, folks. I'm not going to go through all the data we have in states, but we have a lot of data showing increases. For example, poison control centers, big increases. We're seeing data when it comes to you know, the fact that in public housing, it's everywhere now. We're seeing that they, you know, again, and these are going to be the poorer communities of color that are exposed. This was a major study out of Mount Sinai showing secondhand smoke exposure among the poorest kids in our country. How is this going to help them is what I'm wondering. You know, how does this lift them up? It doesn't. And unfortunately, a lot of these communities are really being sold a lie. So you can purchase Smokescreen online or really anywhere. I think it was really a book that took me many years to write, unlike my first book, Reefer Sanity, which many of you I know about. That was called Reefer Sanity, 7 Great Myths About Marijuana. That book I wrote very quickly when I left the Obama administration to just get as many facts out there as possible. This one was really more of an in-depth investigative report. So I hope you find it useful. I wanted to give a little bit of a preview tonight with it. You can absolutely get involved in what we do at SAM, training events, volunteer opportunities, state affiliates, donations. We need as many people involved as possible. You can email Brendan at learnaboutsam.org or just go to our website to contact us. We would really love to hear from you.